Clearance. The dose that became toxic. A patient with severe kidney disease receives a standard drug dose. After several doses, he develops signs of toxicity. Not because the dose was wrong, but because the drug wasn't being removed fast enough. Why did a normally safe dose become toxic? The answer lies in drug clearance. What is clearance? Clearance is the volume of plasma from which a drug is completely removed per unit time. It is expressed as milliliters per minute or liters per hour. Importantly, clearance represents the efficiency of drug elimination, not the actual amount of drug removed. Mathematically, clearance equals the rate of elimination divided by the plasma drug concentration. So, a higher clearance means the body is more efficient at eliminating the drug, while reduced clearance allows the drug to remain in the body longer. Total body clearance. Total body clearance is the combined clearance produced by all organs involved in drug elimination. The major component is renal clearance, where the kidneys eliminate drugs through filtration and excretion. Another important component is hepatic clearance, involving liver metabolism and biliary removal. Drugs may also undergo other clearance, including pulmonary and other extrahepatic routes. These individual organ clearances together determine the total body clearance. Clinically, each organ contributes independently. Therefore, when an eliminating organ fails, total clearance may decrease, causing drug levels to rise and increasing the risk of toxicity. Factors affecting clearance. Organ failure. Kidney disease reduces renal clearance, while cirrhosis reduces hepatic clearance. Drug interactions. One drug may inhibit metabolizing enzymes, such as CYP450, thereby reducing the metabolism and clearance of another drug. Age. Newborns and the elderly generally have lower clearance rates. Key properties of clearance. There are three key properties of clearance to remember. First, clearance represents efficiency, not amount. It tells us how efficiently the body eliminates a drug rather than how much drug is removed. Second, for most drugs following first-order kinetics, clearance is concentration independent. This means clearance remains constant even though the plasma drug concentration changes. Finally, clearance is expressed as milliliters per minute or liters per hour because it represents the volume of plasma effectively cleared of the drug per unit time. So remember, clearance is a volume per unit time, not an amount of drug per unit time. Clinical importance. Maintenance dose. Clearance determines the maintenance dose needed to maintain steady state concentration. Dosing rate equals Cl times target steady state concentration. Dose adjustment. Reduced clearance, for example renal failure, requires dose reduction to avoid toxicity. Steady state levels. It takes about 4 to 5 half-lives to reach a steady state, but the actual level of that steady state is determined by the clearance. Relationship with half-life. Clearance has an important relationship with half-life. As shown in the formula, half-life equals 0.693 multiplied by volume of distribution or Vd divided by clearance or Cl. Therefore, half-life is directly proportional to Vd and inversely proportional to clearance. If clearance decreases, less drug is eliminated and the drug remains in the body longer, increasing its half-life. Similarly, An increased VD can prolong half-life because more drug is distributed into tissues. Clinically, a longer half-life means the drug persists longer, which may increase the risk of accumulation and toxicity. Key takeaways. To summarize clearance, remember three key points. First, clearance represents the volume of plasma cleared of a drug per unit time and reflects the efficiency of elimination. It is expressed in milliliters per minute or liters per hour. Second, total clearance is the sum of renal, hepatic, and other clearance. Therefore, organ failure can reduce clearance and cause drug accumulation. Finally, clearance is important for maintenance dosing and steady state concentration. The dosing rate is determined by clearance multiplied by the target steady state concentration. Hence, when clearance is impaired, the maintenance dose or dosing rate usually needs adjustment. Common Viva questions. Before we finish, try answering these two commonly asked Viva questions on clearance. 1. What is drug clearance and what are its units? 2. What happens to the half-life of a drug when its clearance decreases?